You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. My first guest says nobody should be wearing a loose-fitting denture. And he says whether you're missing one tooth or all your teeth, or if you're headed to a denture, you have to hear what he has to say. With us talking about the newest trend in dentistry, mini dental implants, Dr. Haralampopoulos. Dr. H, welcome to the program.
I'm glad to be here, Randy.
Now, for people that don't know your practice, I guess you're a periodontist. You have endodontists in your practice. You have your daughter in the practice. I guess she's a general dentist. But I guess you do more than mini implants. So who comes in?
Well, we have patients that need root canal treatment. They have sensitive teeth or painful teeth or abscesses, and we treat those particular patients.
All right.
We have patients that are periodontal patients. They have gum disease, and they have loose teeth. They have bleeding gums, they have swollen gums, and we try to restore and keep their teeth. Often we do this with advanced dual wavelength laser techniques. Okay. We also have patients that come in for implant dentistry. These are patients that are missing one tooth, two teeth, many teeth, or all their teeth.
Now, we said at the top of the show that nobody should be wearing a loose-fitting denture. You believe that?
I believe that, absolutely true. These days there are many techniques and weights to anchor these dentures for patients, which will allow them to eat better, smile better, taste food better, kiss better.
Okay. So now, where you are in Chicago, are there a lot of people wearing dentures?
Oh, there's lots of people. There's my daughter and I had done a study, for example, and it was called Mini Dental Implants, the Friendly Dental Implants, a periodontal perspective. And when we were doing this study, we researched to see how many people in the United States didn't have teeth. And at that time, 35 million people were without teeth, and there were actually 178 million people that lost at least one tooth. And it was expected in the next two decades that this would grow. In Chicago, there are probably 50% of the people in Chicago probably are missing at least one tooth. If we interpolate the numbers that I mentioned, and there's probably 10% of people are wearing dentures, enough people to fill every stadium that we have in Chicago.
There's that many denture wearers?
There's that many denture wearers.
Okay, so if mini implants are so good, why aren't they all doing it? Why aren't these people coming in to get their denture attached to these mini implants?
Well, Randy, I think there's probably about 4 or 5 reasons. The first reason I would say is they just don't know what's available out there. They don't know what their options are. Denture patients are patients that have gone to dentists in the past, and now since they're wearing a denture, they don't see a dentist quite as often as they did before.
So they don't have to go?
Well,
they don't know their options?
They don't know their options, but they still go to dentists often. They go if they have broken dentures, if they have sore spots, if they need a reline of the denture, if they pop a tooth off the denture. So they still see a denture.
So mini implants work?
Mini implants work.
And you say they're half the cost of regular implants?
Yes, they're half the cost. And they actually, when you do in the mini implant case, especially for a dentureless person, we're not necessarily charging per implant per person. So if someone's missing 32 teeth, you're not putting in 32 implants. The second reason these denture patients are not coming in is because they self-diagnose. They feel they may be too old. They feel they may have medical problems.
Well, how old can you be?
I don't think there's any limit to the age that a patient could be to have mini dental implants. They're really kind and friendly type implants. I have patients that are 93 years old,
93 getting this done?
Absolutely.
Why would they want to do it?
Because Randy, they're just like you and me. They want to be able to eat. They want to be able to smile. They want to be able to enjoy going to a restaurant with their friends. They want to be able to look at a menu and be able to choose the things that make them healthy, the foods that make them happy. Another reason they don't want to come in, Randy, is because they're afraid of the cost. They've gone to dentists all their lives, and they've gone from root canals to crowns to bridges to some more extractions to partials. So when they finally get their teeth out, they're happy. Not really happy, but happy that they're at least done with the dentist for a while. When a patient goes to the denture that first week, they're really miserable. They can't taste their food. They gag with the denture. They have sore spots with the denture. They're not happy campers.
So they just adapt.
Oh yeah, humans are very able to adapt. they could get used to wearing a denture, and over time they even forget that this is the only way they could be, and that's where mini implants come in, and we could give them something more that's life-changing to them.
Okay, good. Now we should talk a little bit about your experience. Number one, you're a periodontist, right? That's the gum specialist. You're also a surgeon. Does it cost more to go to a specialist to get this done?
Not necessarily. Dental implants, when you do edentulous patients, there's just a charge per case. It's not like when you, a lot of offices where you would charge per implant and charge per crown. Basically, there's a charge per case. Sometimes we put in 6 implants. Sometimes we put 8 mini implants
for a full arch of teeth.
For a full arch of teeth, not talking about. Sometimes we put 10 mini implants in. It depends on what bone the patient has available, and we do the case that needs to be done for that particular patient. And the cost doesn't change depending on the amount of implants we put in. We charge per case.
But you've been doing...
And even mini dental implants, they're usually half the cost of other implants.
Is that right? And they work?
And they work.
Just as good?
Just as good.
Okay.
There's been studies to show over 5,000 patients, and these are patients that include patients with no teeth at all, and patients that had crown and bridge, permanent teeth. And the study revealed that the percentage of success was like 95%, which is equivalent to what you would get with conventional implants.
So the mini implants stacked up just as well as the regular implants?
Absolutely. Mini implants stacked up as well on these studies and other studies,
but you've been doing this 30 years, right? You said you've been doing implants for 30 years.
That's correct.
Is there a big learning curve?
Even for me, there's a little learning curve to do mini implants. I've been doing implants, like you said, for 30 years. I started out at a time when we would do things that were called subperiosteal implants, which involved opening up the gums, taking impressions of the jaw, coming back a week later, and having a lab put something that lays on the jawbone. There are times when I would go to a pinaural radiograph and I would draw on the X-ray what we used to call a blade implant. There weren't even blade implant companies when I first started. And I would send this to machine shop, and they would form this particle, and then this implant, blade implant. And I have to go freehand and go along.
So it was a bigger surgery back then?
Oh, big surgery, bigger
like
surgery.
Big downtime?
Big downtime, big surgery.
So now it's easy?
Well, the trend has been to go, like I said, from bigger, more complicated cases to the simplest cases. And the simplest of all cases is mini dental implants.
So you like mini implants?
I like mini dental implants.
It's good to hear from a periodontist, because I've had periodontists that really have come on my show and said, Randy, this is off camera. Yeah. I don't think they work.
Yeah.
So they do work.
They do work, and many periodontists say that because they haven't really tried them themselves. And like you said earlier, there is a learning curve. And you have to actually take courses to understand what can be accomplished with mini dental implants.
So no more dentures?
No more dentures.
They should all be attached to something.
They all should be attached.
Is that your feeling?
Absolutely. If people want to improve their quality of life, they should think of some ways of attaching their denture. They don't have to live the way they are. They don't have to suffer the way they are.
But isn't it true, if you've been wearing a denture for like 20 years, that I guess your bone dissolves away and you can't do this? Is that right?
It's not true, Randy. There's always techniques that we could use to help stabilize a denture or put permanent teeth in the patient. There's always spots with the techniques of radiology that we have here with 3D scan, CT scanning, where we could find areas of bone where we could accommodate patients that had even lost quite a bit of bone. Also, there are techniques as a periodontist that we do quite often where we could actually grow the bone back if needed. Sometimes these cases are a little more complicated, may take a little longer, but things can be done for most patients. I had this one woman, and she was told elsewhere that she didn't have enough bone to actually stabilize her denture, and she would need a reconstruction. She did not want to go this route. She had a lower denture, was pretty good shape, and we were able to take this existing lower denture, save her some money, and stabilize it into her jaw. Her jaw was probably the thickness of my baby finger, little thinner in the back, half the width of my baby finger, and probably the thickness of my baby finger in the front. Placed 4 mini implants into that area, stabilized her denture. Some of the comments she made me afterwards, that she was so happy now she could run after her grandkids and yell at them and without her teeth falling out. And her husband was so thankful that she once again became like a new person. She was smiled for photographs. She would go out with her socialize with her husband more than beforehand. Beforehand, she would go out with her husband, and they would meet friends and family, and she would sit in the corner and not say anything for fear that if she laughed or joked too hard, the dentures would fall out of her mouth. So this is some of the things that are life-changing in this particular patient. And we were able to do something that other offices felt could not be done.
Now, we talked in the green room, and you said this is the happiest group of patients. And some patients, when it's all done, they want to hug you, or they do hug you. Is that right?
It's absolutely true. They come out of the procedure, they see their face for the first time in a mirror, tears start rolling down their eyes, they start hugging me. They start hugging my daughter more than me.
Your daughter's a dentist.
My daughter's a dentist,
okay.
right? And sometimes she's involved mainly with the restoration of these patients, where I'm involved with placing the implants.
You do the surgical part, and she does the teeth.
Right. Dr. Nicole does the teeth, and I do the surgical part. And these patients, she has such a great rapport with these patients that they're very open to her.
So I guess how it's normally done with the implant process is you go to one doctor that does the surgery, and then you go to another dentist that puts the teeth on top. In many of these cases, you're doing it all right there. Is that right?
That's true. When we have a mini implant case, we do it in our office under one roof. You have better control of the case, and you have better success of the case when you can do it in one location. Mini implant cases are type of cases that have to actually proceed kind of quickly. We get them into their final teeth a lot faster than we would with conventional implants. When we have referrals from other offices, we do
work as a team with these.
Work with the team, absolutely. But with conventional implants, there's a 3 to 4 month, 5 month healing period, where with mini dental implants, healing occurs quickly and are more successful if you proceed faster.
How soon can they eat? Okay, so you attach them onto the mini implants. How soon can they eat?
They can eat right away. They walk out of the office with their teeth secure, and they could chew anything they want. Initially, we tell them to start eating softer foods, but they could really go ahead and eat anything they want.
Now, you brought some photos. What are we looking at?
Well, we're looking at the first patient I brought here is a patient that's 93 years old.
Okay.
So this particular patient, all her upper teeth were in trouble. She didn't want to go to denture. Most places would have pulled out her teeth and put her into denture, maybe go to conventional implants. But in her particular case, because I'm a periodontist, we wanted to salvage the teeth we could. In this particular case, we salvaged 5 of her upper teeth and placed 6 mini implants. She was so happy afterwards that we did the case so fast, and that her friends give her many, many compliments on her smile.
Let's take a look.
You want to take a look at her smile?
Very nice. She's 93. She looks great.
She's 93, absolutely, and comes in and is happy as a lark.
And she can eat whatever she wants with those?
Yes, she can eat whatever she wants because they're permanent teeth. These are really like crowns and bridges on implants. These particular type cases, when they have some of their own teeth, they actually could feel, they have what we call proprioception.
So it feels like they're regular teeth.
Right, and these regular teeth, there are regular teeth, plus there are implants which feel like regular teeth, and they're able to have more feeling than they generally would have if they had all the teeth taken out and put into dentures. So here's a patient, he has upper and lower dentures, he heard about us, and he wanted to get, actually I was his second opinion,
all right.
And he wanted me to find out what we could do for him. He didn't really feel quite right with how he felt about himself. And when we completed his case, he felt normal. He says these teeth felt like part of him, and they're my teeth, he would say. And I can't believe that I went so long without my teeth. He doesn't think about his teeth anymore. They're just part of his life now. So, and when he first came in, I could hardly get him to take a smile and take a picture for the camera. And then when we had left, he was joking, he was laughing. He's the most friendly patient. Didn't even realize how friendly he was until after he got his teeth.
So in this after, okay, so those look like real teeth. And I'm not, people need to know, I'm not trying to side with you. I'm just, but I think if anybody looks at this, those do look real.
Yeah.
So you're in on the design, or your daughter who works with you is in on the design?
The daughter and I are in the design in every step of the way. We're not only looking at how the teeth look, we look at how much of the teeth show in relation to their lips. We look at the phonetics of a patient, how they speak. We also look where the midline is. We also look at what we call the cant, but the cant means the angle of the smile. All these things are important to make a patient look normal. And this particular patient felt that he was normal again. His teeth look very masculine. He looks 30 years younger. You can even see that his jaw is more squared off. He's very pleased with the results. He had, like I said, opinions from other places. The cost was double of what we charged.
Because you're using the mini implants.
Mini implants are a lot less expensive, and they do the same thing. Randy, look at his before.
Yeah.
We tried to take a picture of him, and when he smiled, he couldn't hold his denture up. That's his tongue.
His tongue had to hold it up.
His tongue had to hold it up. And this is a problem with a lot of patients with dentures, especially lower dentures. When they try to talk, they use their side of their tongue to keep the denture down. When they eat, they have to kind of keep the denture down with their tongue. There's great disadvantages, but look at him afterwards. He's laughing, he's smiling. I mean, like I said, he's joking around. He's like a new person. I really feel we transformed his life. He feels we transformed his life. He tells me it's the best thing he ever did. He's very happy.
Yeah, but what about people that have, and I had to ask you this, because we're talking about denture wearers, giving them a set of teeth that don't come in and out or locked in, right? But what about the people with bad gums, like bleeding gums? If you have bad gums and you're losing your teeth, can you still do this? I mean, are your gums strong enough to hold these mini implants?
If they're already, absolutely, Randy, if they're already missing teeth, then we can add teeth where they're missing teeth. By proper treatment of gums, we could treat them and still place the mini implants in there. We could give them full complements of smiles. And I would say a majority of our patients, because as a periodontist, they want to keep their teeth, and that's why they're in the periodontal office to begin with. And now we add mini implants to the case, give them teeth without necessarily being removable type of situation. Randy, let me show you another case.
Okay.
Here we have a lady. Here you are.
All right.
Here's a woman, came to our office. She was missing her front teeth. No one could do anything for her because she didn't have enough bone. Her only options was a denture or a partial. She did not want something removable in her mouth. So we provided her with mini dental implants, and we cemented crowns on these particular mini dental implants, and we gave her back her smile. And you could just see by the pictures.
Very nice.
Yeah. You could see by the pictures that she had attitude. You could see how she changed.
What do you mean attitude?
Attitude. We try to take these pictures in her mouth. She'd turn her head this way, she'd turn her head there. She would pose like this, she'd pose like that. And these are pictures she had after we took her teeth out.
They look like real teeth.
Oh, they do very much so. And they feel like real teeth.
So it's supported by mini implants. The full arch of teeth are just locked in.
No, this is not full arch of teeth. These are just individual teeth in this area here.
Or where she was missing.
Where she was missing teeth that have been supported and attached to mini implants. She can't remove them. We can't remove them. They're in there permanently. They're part of her. I don't even think she could have had bridge work done because the other teeth already had crowns. She would have had to take out all the crowns on her other teeth.
So upper denture she probably would have ended up with?
In the end, it would have started to make more sense to go to an upper denture if she started taking out all these other teeth. And the span was quite long, and she really couldn't support a longer bridge like that would not have been well supported.
Now, you mentioned that this woman goes somewhere else, right?
Correct.
And they tell her she doesn't have enough bone to get dental implants.
Correct.
But you're able to do with mini implants.
Yeah.
So what are you doing that's different, where you are able to work with her bone and they couldn't?
Well,
help me understand.
Well, we have imaging in our office that allows us to evaluate the bone perhaps better than the other offices did. And we have newer techniques, and these techniques involve mini dental implants and how to use these mini dental implants under a lot of different situations. And in her particular situation, we used them a certain way that allowed her to replace these teeth without getting rid of all her other teeth. Here's another gentleman, another patient that we treated. He has an interesting story. He went to the military, someone tried to play a joke on him and put stones in the soup.
Oh my goodness.
He cracked all his back teeth off, and the military replaced this with a removable partial. He went 30 years without teeth. With this removable partial, he couldn't chew as well. He didn't like it as well. He kind of felt he had to give up teeth that he kind of unjustly lost.
Yeah.
And the reason he came to our office, his wife came to our office, had some implants at our office, and he thought, why not do something for himself? He ended up We ended up replacing his teeth with mini implants. By the way, no one had told him that he could do mini implants until his wife came to the office. And at that point, he realized he maybe could do something for himself. So we placed these mini implants in his mouth. We placed these implants in his mouth, and all of a sudden, his whole personality changed.
Really?
I thought he was a quiet guy, but all of a sudden, he started cracking jokes. He was a comedian. He was so pleased. He was so pleased with the results in the back of his mouth that he wanted to really correct the teeth in front of his mouth. And you could see he had a little gap between his teeth there. And we ended up restoring that and closing the gap. And we gave him something that he lost unjustly. So Randy, here's the next patient.
All right.
She's an 85-year-old woman. She was missing teeth. You can see in the photo she's not smiling, either because she was embarrassed of her teeth or because she was embarrassed of her teeth.
Are there a lot of people that just never smile because of their teeth?
She's a very typical patient from that point of view. She couldn't chew. One of the reasons she had these teeth, she didn't want her husband to see her without teeth. We were able to place she was headed towards a denture. She had some broken down teeth, which were extracted. We added some implants in her mouth to correct the spaces that she had, and we converted her, we transformed her into a pretty smile. And the thing that she said to me was she could eat steak again. She loved eating steak. I mean, she must have mentioned it 3 times that she was able to eat steak again. But pleasing her husband was very important. And she's a typical case that can't be helped with dental implants.
So when you give them teeth, like a full arch of teeth supported by these mini implants, I mean, they could bite into like a vegetable with the front teeth?
Oh, they could eat a vegetable. They could eat a steak.
Like a carrot?
Like a carrot, like an apple. Remember the fellow that I showed you earlier? They had upper and lower dentures. He could go into an apple and just tear right into it. And patients that have some of their own teeth.
So she was headed for an upper denture.
She was headed for an upper denture.
You think you saved her from that?
I think I saved her from that. But her case is easier to eat an apple than the person that has all his teeth taken out. Randy, here's another patient.
All right.
This particular patient had visited another dental office first, and he was heading for denture. Actually, the other dentist already started taking out his teeth, and he ended up removing most of his teeth except for 4 teeth. Patient was miserable when he put a temporary flipper in there, and he was trying to seek another method to maybe salvage what he had.
And to avoid a denture.
To avoid a denture, definitely. With 4 teeth, the most logical choice is to take out the teeth and make a denture. But for his particular case, psychologically, it bothered him to take all his teeth out.
Okay.
So we try to help him by placing mini implants along all the front teeth there, secured by crowns. They're cemented into place. You can see in the first picture, even his eyes aren't happy. You could see he's forcing his smile. And then in the afterward picture, you can see how he's happy, he's smiling.
Very nice.
We're a very happy patient. Feels like a new man. I called him on the phone the other day and just to talk to him, and I could see the smile in his voice just by hearing his voice. Yeah, it was amazing.
We're just about out of time. But final message to the denture wearer, right? You say that most of these denture wearers, they don't go to the dentist anymore, so they don't know their options, and they don't know how good it could be to get teeth that are locked in, right? So, but let's say they're watching this and they're still afraid for whatever reason or skeptical. And then also the other group of people that are headed to dentures, right? They know they don't want dentures, but you say that giving them teeth supported by mini implants would be a better option. So what's your final message to them, these 2 groups?
My final message to these particular patients and these 2 groups is there's really no reason to have missing teeth, bleeding gums, and unsecured dentures and not be able to chew the food you want, smile the way you want, talk the way you want, kiss the way you want, laugh the way you want, socialize the way you want.
As I mentioned, we're out of time, but tell me the options. Like, if a patient, you can't save their teeth, right? Their only option is a denture or these mini implants and teeth, locked into those. So what do you say to the person that you can't save their teeth and then the people that are currently wearing dentures? On the consult, what are their options?
Their options are you could put 2 mini implants in the lower area here and hook a denture onto these 2 implants. But these dentures rock up and down. They don't really stabilize in the back part of their mouth. They still collect food underneath those dentures, but they're better than they had beforehand. You could go one step further and put 4 mini implants in that area, and now you could actually lock the denture a little bit better. But beyond that, the next option, which is ideal, is placing 6 to 8 mini implants and taking a full set of teeth and locking them into place. These patients could eat better, they could smile better, the whole roof of their mouth is open so they could taste food and the temperature of food better.
And they can eat whatever they want with these.
They can
like
eat
chewy food too?
Anything
Popcorn
they
or
want.
nuts?
Popcorn, nuts. They could eat steak. I mean, some patients try to eat ribs with them. Anything is possible once you restore these patients with these mini implants.
We really are out of time, and I know you brought cards, testimonials. I mean, these patients write pages and pages of nice things about the process. See, going into this, I'm thinking it's just teeth, but it's more than that, I guess.
Yeah,
obviously.
Absolutely. It's more than teeth. It's how you change their lives. Smiles are contagious. They make people happy. They reduce stress when you smile. Metaphorically, when you smile, you're kind of hugging the other person without even touching the other person. Smile makes people happy. Laughter, you change a person's life. The way they think about themselves, the way they feel about themselves. They start loving themselves more. And
you witness this all the time.
I witness it all the time. They improve their relationships, and relationships are important to people. And the relationship they have with themselves is most important. How you feel about yourself is how you feel about.
So it's a boost in the self-esteem.
Boost in self-esteem. They have better relationships with themselves. They have better relationships with others. So invest in yourself. Love yourself. Take care of yourself.
So if you have bad teeth, do something about it.
If you have bad teeth, do something about it, because something can be done, especially with these new techniques with mini implants.
You love mini implants.
They're so much easier for patients. They're less traumatic. You can use them on older people without hurting them at all. Healing is faster. You accomplish the same things that I used to do with these big implants where we used to tear the people's jaws apart to put them in. These days, it's like going to a dentist. You go in one visit and something can be done for you.
I want to thank you for coming to the show. Excellent stuff. Sorry to cut you off there. But mini implants, you think this is the future of dentistry? Everything's getting smaller?
Everything's getting smaller and less invasive and more comfortable for the patient.
All right, thanks again. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.